I am a urologist, and a urologist is a person who does surgery and treats the urinary system. And my specific type of job is a reconstructive urologist. So when somebody has something wrong in their urinary system that needs to be rebuilt or repaired, that's my job. My job as a reconstructive urologist is to repair the lower urinary system when it's not working. So if the urinary system is blocked because of scar tissue or a trauma, we rebuild it. If the urinary tract is not just functioning in general, we do our best to rebuild it. So I'm 6'5", so my first time in the OR was scrubbing on a urology case, ironically enough. And because the surgeon tended to be a little bit shorter, I had my head right into the OR lights almost. So as a consequence, I got very hot indeed and warm. So my first time in the OR, I passed out. And so that was my first experience. And I thought, there's no way in a million years that I'm ever going to be a surgeon. I can't even stand up in the OR for an hour without passing out. But as it turned out, there was probably a pretty good reason. And I've only passed out 100 more times since now. I haven't passed out since, at least that I recall. But so that was my first experience. And that's what I liked about urology was, you know, after passing out in the OR, it was nothing but jokes and laughs and stories. So that's what drew me to urology was, you know, if you're dealing with urine and penises for most of your day, you can't take yourself too seriously. Typical day varies quite a lot for urologists, and that's one of the things that drew me to this occupation, is that for a lot of people, they show up to work every day to the same office, to the same desk, and stare at the same computer monitor. So that's the last thing that I do. So my typical day could be, I could be in the office, assessing people in the clinic, and talking to them about their problems and coming up with plans to help them. My day could be surgery. It could be major reconstructive surgery involving 4, 5, 6 hour operations, or it could be surgery doing very small 5 or 10 minute operations. Patients come in with a broad spectrum of diseases. So as a urologist, sometimes we have to deal with someone's genitals on a routine basis. And the spectrum of what people come in with genital problems is amazing. Sometimes, well, usually. So you'll have an 85-year-old man who says, I think there's something going on down there. And he could have a tumor, a cancer on his penis the size of a softball. And he's not sure that there's something wrong. Or you could have a 20-some-year-old guy come in and thinks his penis is horribly abnormal and falling apart, and there's absolutely nothing wrong with it. So patients vary because they all have different expectations and different points of reference, and then every patient is different. You walk in, and of course you talk to the patient, and in the OR, what happens to me is my preoccupation is, you know, everything. You have to be aware of the patient, tell them, communicate to them what's going on, answer their questions, while the anesthesiologist is asking you what kind of antibiotics would you like, any anticipated issues, and the nurses communicating to them what kind of equipment will you need, what kind of sutures will you need. And then there's the resident and the learners who you want to make sure they understand what you're doing and they're getting something out of it educationally. Probably so many. Like, I can remember when I was a kid, just in general, my grand aunt and grandmother saying, you can't go out with your hair wet because you will get arthritis in your neck. Not true. Reading in the dark will cause you to go blind. Also not true. And other things like, all the vitamins in the bread are in the crust. They're not true either. So those are myths in general. The one that I always get asked as a urologist is the myth of the blue balls. And so I think this is a myth perpetuated by young men in a quest for sex. That I don't think there's a such thing as blue balls. Nothing happens to your testicles if you don't ejaculate regularly. So the myth of the blue balls is a false one. Well, I don't know. I mean, that's a tough one, because the person you are in high school is not the person you become in life. So I think it's virtually impossible to know what you want to do for the rest of your life when you're in high school. So I think my advice is to find out everything you can about every possible And that means everything. Talking to a plumber, talking to a welder, talking to a teacher, talking to a lawyer, talking to an accountant, and just shadowing, just seeing everything you can. I didn't treat myself with the utmost respect. I ate bad food. I probably didn't exercise like I should, and I thought I was invincible. So although the body's tough, no one's invincible. But I think high school students probably need to know that although the body is very resilient, you still have to treat it with respect.